Hello, everyone, and thank you for joining us today. We're going to talk about triaging, telehealth, and the role of the patient advocate. Let's start from the basics. Telemedicine is actually remote medicine, as we all became very familiar with it during the last year. And you will hear more actually about telemedicine from Dr. Jane Dunham, the head of primary care at Virginia Mason during the conference. So we define it basically as healthcare delivered through an audiovisual or solely audio medium. People forget that a phone call is actually telemedicine. It can increase accessibility and efficiency of clinical care and has the potential to impact patient satisfaction. So it's a very important form of medicine. It was already trending upwards before COVID hit. Its availability was due to video transmitting hardware becoming more available, HIPAA compliant software also being more available, and reimbursement was increased. So when a physician was able to do this compared to an in-person visit, they were actually able to get the exact same reimbursement. These are the reasons why we saw increased availability. During the last decade, when we saw that there were many different studies that came out about its effectiveness and its appropriateness, and even before COVID, we knew that this was a way to provide care that was really appropriate and effective for low-risk urgent care, chronic conditions when we wanted to monitor clinical signs or manage symptoms and prescriptions, consultations for even diagnosis and treatment with specialists, advice and tools for self-management during education and coaching sessions, case management, which I think a lot of advocates know can be done remotely, even physical therapy and occupational therapy, which is hard to imagine. Excuse me. Discharge follow-up for after hospital stays, and for non-emergent care for patients in facilities of long-term care. And then COVID hit. And then we got about 2,632% increase in telemedicine use in Medicare and CHIP patients alone, which is pretty amazing and tells you why this is so important. I spoke with Dr. Wong, the Associate Medical Director from University of Washington Digital Health, and I asked her what is actually happening now. And she said that we still are dealing with COVID fear quite a lot, actually, where people who are elderly, people who have complex chronic conditions, and those that are immunocompromised still are very fearful of coming in, so they do prefer telemedicine. The social determinants of health continue to play a role and will probably continue forever to play a role in telemedicine. You know, if you don't have the money to have a video infrastructure at home, that's a problem. If you have 5 people living in the same room, you don't have privacy, that's a problem. She also mentioned to me that at the University of Washington, at least, they saw almost perfect ways of telemedicine with the COVID surges. So I think that's interesting to know because it can tell us what to expect in the future. And she said that many patients by now have really thought long and hard about telemedicine, and they have made up their mind about what they want and what they don't want. And you see a lot of them always kind of preferring to first visit the provider in person and then do follow-up care remotely, or you see people doing the reverse. All of this was able to happen because rules changed and relaxed, and telemedicine had kind of parity for reimbursement, but also very importantly, and we saw this in our own practice, specialists from different states could see patients in different states than the one they practice. These rules are now changing. They're shifting back to what they're used to be. And as far as I am concerned, my personal opinion is this is a big shame because a lot of care by specialists needs to actually happen cross-state. And I couldn't put it better than the patient advocate who was part of the PCOR diagnosis project I was involved with, who said, think about how many lives could be saved through the use of telediagnosis, which is basically telemedicine using it to make a diagnosis, especially for those with hard to diagnose, stigmatized, or rare conditions. So I'm hoping that the debate will continue and we may see a shift back to COVID era rules relaxing. We'll see what happens. So that's kind of a background about telemedicine. And I wanted to talk about today how advocates can assist triaging. Obviously, we're not providers. Obviously, our role is not to do triage, but how can we help the care teams? I'm going to talk about some general considerations, and then we're going to close this short talk by telling you what are the best practices now discussed for providers. And you'll see how these two will come together. Biggest telemedicine risk, Dr. Wong said this to me, with huge kind of letters, is misdiagnosis. You're afraid you may miss a symptom, you may miss a presentation when you're looking at somebody through a video camera, or even worse, when you're talking to them on the phone. And I think that that's where actually advocates can really help. It's important to remember, as she said to me, there are no black and white criteria to decide remote versus in-person visit, but it's all about basically helping providers make that judgment call. Engagements with the care team is very important. Advocates can help derive appropriate information from the patient. You know this client very well, usually, or you're building a good relationship with them. You can ask them about symptoms, new or developing symptoms that have been there, but there is a difference now in intensity or frequency. You can ask them about medication changes, anything that they stopped, anything that they started, and take all of that info to the physicians or other providers that they see ahead of time, so that these care teams have the time to assess and understand what is appropriate for this patient. Another thing to do is also manage expectations of your clients. Patients sometimes think that providers can do things over a video camera that really they cannot. So yeah, you cannot look at my inner ear via the camera, which is something we've actually heard. So those are very important. It's also important to prepare for and treat the appointment as you would an in-person visit. I would say most advocates know how to do this, but patients sometimes don't. So you need a safe and private environment, and you need a backup plan in case something happens with the televisit and the physician still has about 20 minutes to see you. We had that problem very, very often happen to us. So we always had a backup plan that we would agree with ahead of time. This is what's going to happen if we cannot see or hear each other well. And many times we actually ended up offering to host the televisit appointment with the providers because their platform was not able to accept third party, whether that was the advocate or whether that was another family member from another location that really, really needed to be there. So we would host ourselves a HIPAA compliant Zoom meeting most of the times. So 5 areas to keep in mind are the patient preference, the patient barriers, the stable versus unstable condition, the symptoms, and the specialty. When you're trying, to gather information and help triage the case. When we're talking about preference, we're talking about, as Dr. Wong said, most people have made up their minds by now. Is this a person that has tendency towards or away from telemedicine? Are there labs, x-rays, and other things needed? Many patients say, if this is the case, I really want to go in, and I want to go in once and be done with everything. Are they still afraid of COVID? And what would they like to do with this? And convenience, and of course, family members that need to be involved are 2 other things to keep in mind. If a family member really needs to be involved for various reasons and they're in a different state, you don't have many options other than telemedicine, really. So these are things to keep in mind. When we're talking about patient barriers, we're talking about things that prevent access or don't allow appropriate access to take place. So think about, again, a safe and private environment. Is this possible to happen at home? Or do we need to make sure that the patient comes in. Technology, whether hardware or software, is very important. Audiovisual basics, don't think that because they have a camera, this can happen properly. They need really good lighting. They need really good microphone and speakers. And where all of this becomes more important is when we're talking about hearing impairment patients and people with cognitive decline. Depending on how far they are during these processes, it might be really better for them to be seen in person rather than over the video. Reimbursement is an issue, but right now most of these things are still being reimbursed, but we will see what happens in the future. And always keep in mind, cultural awareness. For younger people, the fear of leaving a digital footprint, not so much for the people in their 80s, but the people who are 20, 30, they really worry about that. And think about certain behavioral health conditions that are better off in person versus through a telemedicine visit. When you're also looking at this client, you have to consider the overall patient health. Is this an overall stable client? And they just want to discuss something and they're overall healthy? Or is this a complex patient where usually things are difficult to deal with? That's important to know. When you're looking at the symptoms, it's important to think about new onset versus long-standing symptoms. If this is a COVID case, at least at the University of Washington, they still say, you're not coming in, first appointment is remote, and then we will figure out how we need to escalate or not. And it's important to also keep in mind, are these clearly urgent symptoms, or is this an unclear urgency situation? As Dr. Wong was saying, obviously the things that were acute before still are acute now. If you're dealing with acute chest pain, acute abdominal pain, or profuse bleeding, not only do you need to be seen in person, you actually need to go to the ER. So that doesn't change, and we have to keep that in mind. Also, whether this is a specialist or a non-specialist visit plays a role. Different specialties have different scope of work, and they themselves are now across the country building their own framework as to how to triage. If you're dealing with a client that needs to see a new provider, it's a little bit different than going back to an established provider, especially if they end up seeing a one-off, like, I'm going to Teledoc because I need something. The advocates can really ensure care coordination happens afterwards, where you can follow up with the PCP, make sure you get all the records, et cetera, et cetera. If you're dealing with somebody after a surgical procedure, are there any red flags that they're talking to you about? You need to make sure you convey that to the team. And is it useful for any reason to actually see the patient in their home? What we heard from both the providers and the patients during COVID was that patients felt it was a more intimate thing to see their providers while they were at home. And providers felt that they actually had a better understanding through a glimpse of, the patient's background and home. So maybe there is another benefit to actually use telemedicine for this reason. That's something to keep in mind. So those are the things patient advocates keep in mind. And now I'm going to finish by telling you a little bit what's happening across the country. Right now, best practices are debated across the United States about how providers should triage telemedicine. So this is a very, very timely subject we're talking about today. Two approaches seem to be surfacing right now. One is the descriptive approach, where basically the state is trying to put together specific requirements per specialty or disease. That's what Oregon State here does in our neck of the woods. And then there's a more fluid approach where it's more general recommendations about how to approach this. And this is what Washington State is doing. Hence my picture of, oh my God, this is kind of difficult in this slide, which I think does put providers in a difficult state. These are the more descriptive guidelines that Oregon State has put together. And I'm going to quickly go through these for primary care and for complex care, just to give you a sense of what might be happening in your own state. And I would really encourage you to get in contact with your state so you know what your care teams are dealing with and how you could help. For primary care, the state says clearly anything that's routine for established patients or new patients after we have done a comprehensive screening and we feel that really there's no reason to come in, these are recommended telehealth appointments. Also, if you have an established patient that need evaluation education for an issue that is not time sensitive, nothing acute, that's a good way to do it. On the other side, if you are dealing with people that have a history of needing physical assessment, or are very high risk because of comorbid conditions, or have lack of access problems we talked about before, or their preference is clearly to be seen in person, that's a case where you have to go to a face-to-face encounter. And obviously, anything that needs physical, like a prostate exam, OBGYN, dermatology, those are for in-person, not appropriate for telemedicine. When we're talking about chronic disease management, it's very much the same. So routine follow-ups for established patients, again, telehealth, new patients after comprehensive screening, no problem. If you have new or worsening symptoms that don't require somebody, pushing or seeing you in person, great. Again, if it is somebody with not a controlled medical condition, they go up and down every week, they're different. They have lack of access to anything that can help the physicians triaging, like, I have a high blood pressure client and they don't even have a blood pressure monitor at home, so they need to come in to be measured. Those cases are cases that would tip you over for a face-to-face encounter. So it's nice to know how they are approaching this and how we can help them. And I'm just going to finish by saying in-person care will likely become the norm as the COVID pandemic diminishes, but it will remain an important and desirable option for certain circumstances, certain patients, or certain specialties. And even the CMS has concluded that the genie is out of the bottle and there will be no turning back. So I hope this was all useful information, and I'm happy to take any questions.
Well, I would like to first of all start by saying thank you to HealthAdvocateX. Robin Shapiro, you are amazing. Thank you for allowing me to speak at this wonderful event. So today, I will start off by saying my name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. And I get the pleasant opportunity of speaking to you guys today about, are you standing in your way? Then you must move. Manage your opportunities for your vision to empower. So I'll start off by sharing my little short story. Entrepreneurship is in my DNA. And many times I personally have stood in my way when it comes to doing something. Many times I've told myself I'm not good enough, I'm not strong enough, I'm not smart enough, I'm not wise enough. And each time I blocked an opportunity, I was blocking a blessing. So I had to stop it. I had to stop standing in my way, because who knows if I had said yes to those opportunities, what type of blessings would have came out? No more, no more. Next slide, please. What is your why? Your why or your whys have to be so strong that you cannot quit. So one of my whys is as a nurse, I do not ever want to set foot in the hospital as a working nurse again. It is a toxic environment. And I really feel that as a nurse, I could not be a true advocate for the people that I was caring for. You're an advocate for the hospital or whoever you work for. Another part of my why is my mom. She became ill at the age of 52 with Parkinson's, MS, asthma, colon cancer. So she had 5 different physicians. Nobody had the time to talk to each other. So I thought to myself, what if I was a layperson who had no clue about what's next, what to ask for, what to do next? Those are my whys. I do not want to go back and work for the hospital. Next slide, please. I believe there are 7 strategic components to either get started, and or keep going. So I wrote this memo, this vision to myself of are you standing in your way and how to manage your opportunities for your vision to empower, because I want to be empowering and I want to empower others. So these 7 strategic components will help you get started and help you keep going. Next slide, please. Visions and dreams. Oh boy. When you put something into the universe, whether negative or positive, it reflects back on you. So write down your visions and your dreams, speak them into existence, talk about them, tell them openly. So when you verbalize that, you have to act on it. So that's so amazing about what you put in the universe. You have to act on it because now you put it out there. Be okay with revisiting, revising, and I should also add it in here, reviewing. You have to come back and just kind of just reanalyze and reboot. Be okay with that. It's okay. Because you write it down doesn't mean you can't come back and change it or revise it or revisit it or revision it. Get over fear. Lots of times fear comes from these dream stealers, and lots of times the dream stealers are our family members. They love us. They don't want us to fail, but sometimes their fear is what's getting in your way. And we have to be the one to say, I'm going to set some boundaries here. This is a hard conversation, but we are not going to talk about anything negative about my business, my goals, my vision, my dreams. If we can't talk about that in a positive format, this subject will not be talked about. So we really have to draw that line. And this is hard because sometimes it's the person that's sleeping next to you. So you really have to stand your ground and say, positivity only. We're not going to broach this subject if you don't have anything good to say. Next slide, please. Prayers and planning. I don't know about you guys, but my Lord and Savior is Jesus Christ. I ask a higher being. I get my quiet times where I can really listen to that inner voice. Sometimes you may call that your gut feeling. Be silent, hear that inner voice. Write that down. So when I first started this particular business, I got a journal specifically for this business. And you know how your mind is always thinking, I have an idea, write it down in that journal. I don't care if it's 2, 3, 4 o'clock in the morning. Write that down in that journal. And then you can come back and revisit that and just being quiet and listen to where you're going and what is your vision. You pray about it. Plan, plan, plan. Next slide, please. Goals and affirmation. This is my favorite. So SMART goals. We've all heard that goals should be SMART, specific, measurable. Lots of people say achievable. I say adjustable, relevant, and time bound. The reason I say adjustable is because sometimes when we set goals and they say they're achievable and we don't achieve it, then we get down on ourselves. So that's why I say adjustable, because life is adjustable. So your goals should be adjustable. At the same time, your affirmations should align with your goal. So I like to split my goals up into 5 categories: faith, family, finance, fitness, and I've added fun because I was one of those that are just a stickler for work, and I had to add fun. One of my goals is fitness. So when the pandemic hit back in March, I had always wanted to lose weight. So what I did is I said, my goal is to maintain 125 to 135. Yes, I said it out loud. 125 to 135 weight was attainable for me, and to maintain that. And my affirmation is that I am physically fit. I work out every day, 30 minutes a day, 6 days a week, and I enjoy it. So that aligns. Next slide, please. Invest in yourself. As women, we are told that this is selfish, but I beg to differ. Read uplifting, motivational self-help books, whatever it is that fits your values. Me, I love Jack Canfield. So Jack Canfield is one of my favorites. I have dog-eared this book, highlighted it, marked it up. I revisit it all the time, the success principles, how to get from where you are to where you want to be. So that's one of my motivational books that I love reading. Pick a day for yourself to unwind. You can't give from an empty cup. If you're going, giving all the time, you are going to wear yourself out. Pick a day. My day is Sunday. I try to go to church or look at church online, and then I lay on my sofa, make sure my sofa doesn't fall off the floor, meaning that I need to lay on that sofa. Personal journaling. This is key too. I started personal journaling when I was in middle school, but it's such an amazing thing. If you go back and read your personal journal from maybe 20 years ago, you are not the same person that you used to be. So it's very enlightening to find out like, wow, I've changed so much. Next slide, please. Take courses to increase your knowledge. I commend you, and I want to give everybody a hand for attending the HealthAdvocateX conference, because you are investing in yourself. You are increasing your knowledge. Next slide, please. Network, and then network some more. So as a nurse, I didn't know a thing about networking when I first started networking. People came to us for help. We didn't go and market ourselves and promote ourselves. We basically, okay, you're in, what am I? I'm here to help you. So this is your time is your most precious commodity. So when you network, seek like-minded individuals and seek the right audience. One of the mistakes that I made as a networker years ago, when I was in network marketing, I had a network marketing company, was I would go into a networking event. I'm like, cha-ching, 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 cha-ching. Not the way to do it. Don't ever do that. The wrong way to do it. When you go into a networking event, my key and advice to you is to find two people you never met before, sit down or Zoom with them and find out who they are. What are their goals? What are their values? And then you can kind of categorize them into, is this a business partner? Is this an advisor? Is this a mentor? Is this a teacher? What is it that how they can fit and align with you and your core values? Seek the right audience at the right time, with the right place, with the right information. You got to be in a networking regimen where you are consistent and persistent. Next slide, please. Brand focus. You know your why must align with your actions. So you are what people say you are when you're not in the room. So does your brand encompass who you are spiritually, mentally, financially, business-wise, personally? Your brand should align with those core values. So this all goes together. I kid you not. Put number 6. Okay, great. We're moving on. Support and consultation. Put that pride aside. Ask for help. When we don't ask for help, that's where we're weak, because it's not done to the I'm Superwoman, I don't need any help, or I'm Superman, I don't need any help. We all need help. We all have weaknesses that we can find someone who is strong in that area, and then you don't have to worry about it. Ask for help. This is a team effort. We are in this together. This is about building a village. So don't focus on your weaknesses. Find someone who's strong in those weaknesses and ask for help. Fact, there are no shortcuts. I have had many entrepreneurs approach me and say, I want to go from here and I want to skip all this other stuff and I want to get to here. Not possible. And if you do it, I guarantee you're going to have to circle right back around to where you started from, because you jumped and you skipped something. So it is okay to take your time. Be okay with planning. Be okay with, it's a journey. It's not a marathon. It's not a sprint. It's a journey. Seek the right mentorships. So lots of times in the business world, we've been approached by business advisors, and one business advisor does not fit all. I kid you not. So I vet my business advisors. What are their values? How are they treating other people? What are their testimonies? How are they investing in themselves? Are they in the same industry as I'm in? Because I guarantee you it's a different world in the business industry than it is in the healthcare industry. Healthcare industry is definitely about building relationships, and that takes time, and it's okay. Build your core team, but your core accountability team. One accountability partner does not fit all. So I have several accountability partners, and my accountability partners go back to my goals and the categories of those goals. So I have a spiritual accountability partner. I have a financial accountability partner, personal and business. I have a fitness accountability partner. I have a fun accountability partner. So make sure that you placing your accountability partners in the right way. And lots of times you have to really look at who you are and how you accept correction, because it's not what you say, it's how you say it. So my accountability partners need to come to me and say, Deidre, we planned, you were going to implement these steps. Where are you now? And if you're not there, go back and implement those steps. And then where do you want to be? Where do you want to go? What are your goals in each of those categories? Faith, family, fitness, and finance. Evaluate your own personal definition of success, because just like your personal definition of success is not like my personal definition of the success, I like to equate that to quality of life. What is your quality of life? Because it may not be my same definition as quality of life. So everybody has different definitions of success. So make sure you define that, you understand it, it's at your core, and that you are on top of your game. Next slide, please. Know your numbers. Now, we could talk about personal numbers. I'm not going to talk about that today. I'm talking about business financial numbers. So you have to start with the end in mind. So what do you want to make this year? Then back it up to what do you want to make per month? Then back that up to what do you want to make per week? Then back that up to how many clients will it take for you to maintain to reach those numbers? And you have to incorporate your own financial philosophy. I like Profit First. This is one of my favorites. This book is amazing. I can't say enough about it. It is an amazing book. It keeps me going. It keeps me knowing that I need to plan, and implement. And then when you find your core values of where you want to be for your business and your financial planning for your business, find you a trustworthy financial advisor. And I vet my financial advisors just like I vet my mentorship advisors. Look at their core values. Are they out there just to sell you something? Are they out there are they teaching you? Are they planning with you? Are they seeing where you are now and finding out where you want to go and implementing those measures? Next slide, please. And I like to end with a couple quotes. You can't always control the results, but you can control the activity that leads to those results by incorporating the move mentality. If it doesn't challenge you and make you uncomfortable, it won't change anything. We have to get comfortable with being uncomfortable. We really do. To make the choice, to take the challenge, to make a change and be that difference. My favorite prayer is, God, grant me the serenity to know the things I cannot change. That decreases my stress level because I don't need to spend my time worrying about something that I cannot change. That just increases my stress level and I'm running around like a rat on a wheel. Give me the courage to change the things I can. That means getting that fear out of the way, getting those naysayers out of the way. Positivity, what I watch on TV, what I put in my mind, what I read, what I eat, whatever it is, I need that courage to be able to change the things that I can And I can do that by guarding my space. What do I want in my presence? How can I increase my mind? How can I increase my value? And the wisdom, which is key to know the difference. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator, and we are going to change the world in advocacy. Thank you for your time. And I would like to hand this over to my good friend, Ann Llewellyn. Thank you.
Thanks, Deirdre. And I too would like to thank HealthAdvocateX for allowing me to come today and share, the hot topics. That's what this session is on, hot topics. And I would like to start to ask us to look at and have a call to action using data to amplify your voice. Deirdre gave a great presentation on, some of the challenges and how to overcome those challenges that we find as advocates. But I think today, as we move into the healthcare system and the business of healthcare, we're seeing some new challenges that I would like to talk about. My name is Ann Llewellyn. I'm a nurse advocate. I moved into nursing advocacy recently. I've been a nurse for over 40 years, and then I went into case management in 1988. And after case management really opened the doors for me to see how resilient people are. And they really can do great things if they have the resources. And my role as a case manager was to help coordinate care, transitions of care, and help people find resources that they needed to take care of themselves and overcome some of the deficits that they had, how they could be able-bodied when they were disabled. And being a case manager opened my eyes to the fact that that can happen. And then I have my own challenging, I developed a brain tumor in 2014, and it really sidelined me from work for a couple of years. But that experience, what I walked away with was how hard it is to be a patient. So I kind of pivoted my career to being a nurse advocate and to not so much working for insurance companies or working for hospitals, but working for people. And that's where I feel like our practice takes us, to work with people, the patient, the family. We still work with that care team, we have to. We still work with the payers, we have to. But our focus is really on the patient and helping them to get through their healthcare journey and face a complex healthcare system. So I term us as helping professionals. Today we have a lot of people within the healthcare system who help people. And I'm calling us helping professionals, patient health advocates, case and care managers, social workers, patient experience officers, and the healthcare and the patient experience team, and others that maybe that are popping up. People are popping up all the time. But I have to ask, having all these people in place, it begs the question, are we making a difference? Are we really making a difference in the lives of patients and their families? Despite all of the helping professionals, our quality ratings are not good in the United States. Medical errors are up. The United States has really low rankings when we're ranked against other countries. We are like in the ranks with third world countries. And what does that say about all of us who are in this system to help people navigate it? So despite being the richest country in the world, we still haven't figured out a way to provide safe, equitable care for everybody. We see mortality rates, we see women, maternal child health rates of mortality really low. In the United States of America, why? With everybody working together, why is this happening? And the pandemic, we're still in COVID, but this pandemic has really spotlighted many of the problems that we have within our healthcare system. And while we're fighting through it, we have to take some time to think about how are we going to change things and how are we going to improve. So a call to action for all was in order. And how did this all start? Well, 2 years ago, I guess it's almost 3 years ago now, we had ICOPA, the International Conference for Patient Advocacy. And I was there as one of the planners of the committee. It was our first time to bring this conference out. And we really had a great time. Talked about a lot of tough issues about the role of patient advocates, health advocates. And, you know, Kai Corbett, who was in attendance, she's from Maryland, she came up to me and she said, Ann, you know, this is all good. We're great. We're saying how good we are, but how do we prove it? How do we prove that we're really doing what we do? And it really struck me, and it stayed with me up until today, that her question and her comment really struck me. So at the same time, another woman, Terry Kemtavich, who I have known her for a number of years, and she was retiring. She was closing her company. And we talked, and she said she really would like something to do, and she really was getting into quality measures. And I said, you know, Terry, you know, and I relayed the conversation that I had with Kai, and she said, I would love to work on that. And she really didn't know what advocacy was. She knew what case management was. She knew what the quality, you know, the patient experience people, but she didn't know what patient advocates or health advocates did, or nurse advocates. So Kai and I spent a lot of time educating Terry as to what we did, but she really could see a bigger picture, that all the helping professionals, we all need to be able to show our value. So this work group came together. We've met a couple times over the past year and a half, and we are making a little progress, but that's why when I saw the HealthAdvocateX conference come out, I wanted to be a part of it. And I wanted to share this information with people who are in the helping professions to see why we need to maybe think a little differently and be able to show our value. So are we making a difference? Do the people we work with, the patient, the family, the healthcare team, the leadership in hospitals, managed care organizations, employers, legislative leaders know who we are, know the impact that we make in the healthcare system? And sometimes I think they do, and sometimes I'm not so sure, because some of the cases I have, I go in and I was with a patient recently who has liver disease, and we're looking at a transplant, and the pre-transplant nurse was like, why are you here? To me. And I'm there as his advocate. And so I had to really, after I looked at her and really took my breath away, I really thought about it, and I told her why I was there and what I was doing to help this patient. And she got it. She said, I never knew there were people like you out there. And I said, yeah, it's really an emerging field. It's more and more people are starting to look for advocates and ask for advocates because they know they need help. This healthcare system is a challenge to negotiate. So how do we prove what we do? I think that's really the bottom line. We need to let them know who we are, but then we have to prove who we are so we can take that information, that data, to show other people who we are and what we do. Today, we're looking in the current healthcare climate is changing. A new payment system is being introduced throughout the whole healthcare system. Value-based payments are going to require all providers, health, hospitals, physicians, rehabilitation professionals, everybody is going to have to prove their value. The system is going to go from a volume-based payment system to a value-based payment system, and it's going to look at how we are improving the healthcare system to meet the needs of the patient and their family members. So these, it's going to be very important that the helping professionals also start to look at this, and that's why we are having this session today. Traditionally, the healthcare system's been using really complex metrics that focus on clinicians, business operations, as well as reimbursement. More recently, we're starting to look at the patient experience. How is your experience in the hospital? Well, most people would say, oh, it was terrible, or, it was good. I had nice nurses, They helped me understand what was going on. That is what's being measured today. And how are we helping that patient, the family, navigate the healthcare system? That's another, those questions are on those surveys. Did you understand what was happening to you? Did people talk to you? And as advocates, that's our role, is to be involved and to make sure the patient has a voice in the healthcare system. So value-based purchasing is really changing how payments are made, and it's going to change the system more and more. And we, as helping professionals, need to be part of that. So looking at the current climate and what key performance indicators can we choose to use to show our value? We're viewed as change agents in a disruptive healthcare system, but how do we prove it? How do we show what we're doing? We're going to look at some ways that maybe you can find ways to do this. And hopefully this will give you some ideas in your practice, how you can maybe start to collect some metrics to be able to demonstrate the value that you bring. Stress levels. You know, I think everybody has had those calls. I recently took a couple of days off and I was in Philadelphia, and at 7:30 in the morning, somebody called me on my cell phone, and I had my phone with me because I used it as an alarm to wake up. So I answered the phone at 7:30 and oh, did I wake you up? I'm so sorry. And I'm like, who is this? And it was a woman who was calling. Her husband was in the hospital in Fort Lauderdale. And she went on and on. I could hardly even keep up with her, listening to her. But she told me all the things that were happening to her husband. And somebody gave her my name. They said, you really helped her brother, and I would really like to hire you to help me. And so finally, when I regained, started to be able to process what she was saying, I asked her some questions, and things started to fall into place. And I kind of got the really idea what was happening to her. And I was able to start, I got some paper out and I wrote down some things, and I gave her like a list of things I wanted her to do so she could get back to me and we could figure out what was happening. Who was your doctor? What hospital were you in? And what is going on? And as she answered those questions, she became more relaxed. She said to me several times, you are the only person so far who has really talked to me and listened to me and helped me understand what I could do to help my husband. And I always feel sorry for people that they have to tell me that, but that is true out there today. We are the one group of professionals who do hopefully take the time to listen to people to find out what is going on. So think about the stress levels when you get that first call from when you're moving through your cases and a couple of weeks go by. Your people are a lot less stressed. They call you ahead of time. You've gotten them to the point where they call you to ask you questions, and they have some recommendations, they have some answers, or they've told you what they've already done. That's a huge relief to people to be able to do that. So that could be one of the metrics that we choose, how we decrease stress levels. Level of confidence. This is my favorite saying. You probably heard me say this if you've heard me speak before, but I really believe that the healthcare system is built for the healthcare system, not the people who use it. And it is really hard for people, as Deirdre said, one of her whys was her mother went through the healthcare system and she had 5 doctors and nobody had time to talk to each other. That's dangerous. They're all prescribing different medicine. And if they don't talk to each other or come together to some consensus, then we have a patient who's out there that is really confused. And many people are afraid to talk to doctors, ask them questions. So they take it. They just take whatever the doctors tell them. Now, I know I don't want to generalize. There are a lot of good doctors, there are a lot of good nurses, and everybody's busy with COVID. They're not even, people before a few weeks ago weren't even able to go into the hospital with their family members. So that was a whole nother level of stress and lack of confidence. They didn't know what was happening. So our role is to come in to improve that communication, to help that perceived level of confidence with their healthcare provider to go from 0 and increase over time. If we can measure that because of our involvement, I feel more comfortable. I go with a list of questions to my doctor's office now. I've left one doctor because he didn't listen to me, and I now have another doctor. That is confidence that we've instilled in people. This is your care, and you need to have a say in it. So measuring levels of confidence is another metric that we can look at. The ability to navigate the healthcare system. It is really complex. Just going through from different doctors to offices to clinics to rehab programs, and helping people know who's who in the healthcare system. Getting on the phone, that's what I do right now. I've really been using this, getting my patient on the phone with me when I call places. And I had a patient yesterday goes, "Ann, you are fearless." I said, "Well, I am fearless because I'm trying to get things done, and my passion and my perseverance really does come through." So, but how do we help our patients do that, work through the healthcare system? So if you can measure that when you began to where they are today, you can show progress, which is outcomes, which are data points. So if you can do that, that's another way. And then cost reduction data. Healthcare is so expensive. This most recent statistic I heard, the healthcare is what trillions of dollars we're spending on healthcare. I think it's like $13,000 per person in the United States. There's 300 million people at $13,000 a piece. Can you imagine what the cost of healthcare is? Yet we don't, we are not using it wisely. There's still duplication, there's fragmentation. We have medical errors. We have a lot of money being spent on unnecessary costs. So because you're involved, have you been able to contain healthcare costs? This is something many people don't think about. They have insurance, so the insurance company is going to pay for it. But we do need to be conscious of healthcare costs and how to help streamline care, coordinate care, transitions patients effectively across the system, so we are not spending healthcare insufficiently and inefficiently. And the resources are not there for people. We're really reaching a tipping point in our economy where we can we afford to do this? We're talking about, different pay systems to try to reduce costs. That's what it's all about, reducing costs, believe me. But how can we do that as helping professionals? How does that translate to our patients and help them to get them into the right level of care when they need to get there, and to the right providers? Sometimes you waste a lot of time going to doctors who are really not making a difference. So how do we help our patients investigate other providers? So that's another metric that you might want to look at. And then patient satisfaction. Value-based purchasing is going to look at outcomes. The healthcare dollar is going to be divided between 70% on outcomes, 30% on patient satisfaction. So this is an important metric, and we have a large part in helping people be satisfied with the healthcare system. I would ask you to share your stories, talk to people, write in magazines. You don't give away patient information, or you don't disclose confidential information, but we can all write and we can talk about how we impacted and how this improved the satisfaction of the patient, the caregivers, how people came together because of our involvement. And, even doctors were glad that we were involved. I had a physician who was a cardiologist, and he was leaving his practice. He was retiring. And I went with the patient to the last appointment. And the doctor said, when I first met you, you were a real nudge. And I said, really? He said, yeah. He goes, but now I understand why you're involved and you really help the patient. And that made me feel really good because I felt like, I learned how to work with him just as much as he learned how to work with me. I knew when we went in not to ask him any questions until he read the chart. I learned what his routine was so I could be respectful of that. So telling people our stories of how we changed the situation, how we improved an experience is really important. And there's a lot of places to do it, online, through your own blog, but do that and share your experience. And then amplifying your voice. How do we tell, as Deidre said, how do you really build your practice? How do you let people know who you are and the value that you bring? The metrics allow you to do that. It allows you to validate your work. Capturing metrics along with your testimonials will help you be able to show that you're worthwhile. I mean, there's advocates who are charging. I know we have an advocate down here in South Florida, and she's worth it. She charges $250 an hour, and she is worth it. I've seen her work. I've seen what she does. She does not take no for an answer, and her patients are happy. Now, she's working with people who can afford that, but how are you going to get the average person to pay for you if we don't have some metrics to show what we can do and how we can do it? So, that is an important question, and I hope it resonates. Maybe I've given you more questions than you can think about today than answers, but I hope this will be a session that you'll think about. Here are some resources, links. The Institute for Healthcare Improvement on measurement. It tells you how to do it, the patient experience and satisfaction measurements. And this last report, I wrote this because we do have a number of national certifications. And this year for the 2021 report, I added the patient advocate certification, the patient board certification for patient advocates, BCPAs, and I also added the patient experience certification into this report. The other ones are really on case management. But because we have national certifications, that means that's another layer, that's another level that we are raising ourselves. So being able to show our outcomes as a board certified patient advocate, as a certified case manager, having those credentials puts a little more responsibility on us to be able to show what we do. So that's in this report on page 73 is where this session came from. So if you want to download the report and read the article, there's some more information in there, but basically that's where this presentation came out of. So I wanted to give you that link to review the report. So what is our call to action? What are your next steps? If you're interested, join our working group. We are really coming together. We come together maybe every couple weeks, and we talk about, how can we gather data? How can we put it into a system to really show the value of advocates across the board? And then maybe case managers will want to do it for their practice. But we do need to show who we are and what we do. It is really important today as a professional in the healthcare system. If we're requiring of doctors, of health hospitals, nurses, departments like wound care centers and rehabilitation programs and long-term care programs, how are we preventing those emergency discharge readmissions to hospitals after they come back? There are things that everybody is starting to look at, and I want the helping professionals, I want advocates, nurses, nursing advocates, patient advocates, healthcare advocates to be a part of that. So join our work group. If you're interested, you can email me and I'd be glad to talk to you, and we can set up a call to discuss.